want to talk about something that came up to me recently from a doctor, and I want to share it with you and any team members that may have issues with asking patients to pay or discussing payment with patients before we schedule them. I know it can be difficult to talk to patients about money. Don't get me wrong. That is something that not everybody's comfortable with. But there's two parts that I want to talk about with that. One is, first of all, you've got to get comfortable talking to patients about money. If we aren't comfortable talking to patients about money, at the end of the day, patients are going to schedule and not show up. They're not going to pay. They're going to be upset with us. And if we don't get our patients to pay, at the end of the day, we don't have a job because we haven't gotten them to pay for the treatment they're getting done. Secondly, we have to understand that payment is part of the process. You know, you don't go into any other business and not pay for something or not know what you're expected to pay. So I know it can be uncomfortable for some team members, some of you, when asking for patients to pay, but you need to understand that that's just part of the process. Any business would work out payments with patients, whether it's financing or pay up front or pay when you show up, whatever your policies are. But you do that with the patient before you put them in the schedule. And we want to do that because A, we have a business to run and we want to make sure that we're making money to keep our business running. And then second of all, until a patient has fully worked out what they're going to pay and how much they owe and how they're going to pay for it, they haven't fully committed to the treatment. And then there's a higher chance that the patient's not going to show up for the appointment. So it's really vital if you want to help your patients keep their teeth for life, help your practice do well, and help make sure the patients are going to arrive. You've got to get good at talking about money with the patients and reviewing it with the patients before you put them in the schedule. So just wanted to send my 2 cents on this. Please make sure that you practice, you role play, you do training, and the better you get at talking to patients about money and about the treatment and what they need, the better it's going to be for you and the practice and the patients.